My name is Maria Teresa Samson Kadushi. I am the founder of mobileafya, or Afya Info Company Limited. I wear several hats, so I am a tech entrepreneur, an innovator, and a founder of a tech startup. We have been in operation for the past 5 years, since 2016, where we started informally with case studies and then later research. And we were lucky to have mentorship of a professor after a fellowship that I was in. So we implemented HCD methodologies, human-centered design, and we had a very long period of iterating and testing and designing. And then from 2018 to 2019, we were prototyping, so testing our MVP. And in a nutshell, that's our journey. But mobileafya is a USSD application that works to provide basic health information in local and native languages. Our goal is to bridge the gap to health information using accessible technologies. In 2017, our co-founder, Dr. Hilda Ruth Allen Shaw, joined, and together for the past 4 years, we've been building mobileafya together. Yes, and mobileafya is a company founded by women in ICT and medicine, and also led by women in technology and medicine. Our African footprint, our headquarters are in Dar es Salaam, in Mikocheni, but we are working to expand and scale to other East African countries, and we're looking at Kenya and Rwanda as our next locations. The problem that we're working to solve is digital divide in the health sector, and we're working to provide access to health information and hence bridge the gap of information that is caused by the digital divide. And in an example of digital divide, for example, a young person in Dar es Salaam, let's say a 26-year-old university graduate in Dar es Salaam, has very different channels of information, of receiving any information, it being news or global activities or just educational materials, versus a young person, 26-year-old in a village in Katavi, for example, who doesn't have a mobile or a smartphone, who barely has radio connection or radio connection to most of the channels that share news. So this is the gap that we're working to bridge by using mobile technology as a tool to provide information or to give access to information, and in this aspect, health information. Every time I get asked this question, I feel that, it's a bit disappointing that I don't have an inspiration. There was no inspiration. mobileafya started from curiosity. I was living in Singida in one of the underdeveloped regions in Tanzania, and there was a huge number of street children or children living in adversity. So I grew curious to just know why. Why are these children on the streets? Why no one cares? But how did they get here? What happened? And I wanted to learn more about their background, about where they come from, about their families. And that is how it's essentially started. So I started a small case study, trying to understand the problem of homelessness and poverty in children in Singida. And through that, I met parents and families of these children who live in the streets. And what I learned from the parents is that the average age of starting to have children per parent was 18 years old. So there was a significant number of parents who had children younger than 18, at 17, 16, and some at 15. And the average number of children per each family was 6 children. And I mean, for most of the women that I interviewed were in their early 30s. So I came to learn that there was a huge gap in sexual and reproductive health education and information. Many of them didn't know about family planning, about contraceptive methods and such information. So from there, I took it upon myself and I said, I have to create a solution to give these women access to information, access to sexual and reproductive health information, and especially reproductive health information. So Mobile Afya started as Msichana App, and then later Binti App, and the focus was just on women to give them sexual and reproductive health information. But as we continued with research and understanding more, we learned that the gap of information in Tanzania is not only on sexual and reproductive health, and it's not only affecting women. So that is how we decided to scale and cover other health topics and open it up to everyone inclusively. So we also changed our name from Msichana and again Binti to Kijana and then to Mobile Afya, which is what we have now. Our financing and funding journey has been long. As I said, we started back in 2016. So we started with self-funding and covering our own costs. And then we went to family, friends here and there helping us. I had a friend in the US who did a crowdfunding and raised a bit of money during my research time. But then in 2018, we got our first serious funding, and this was from a software company in Germany called Freiheit.com. And they gave us 10,000 euros that we used in testing our MVP and prototyping. And it was a very big boost to now validate our concept and what we were working to do. But I understood from very early on with what I and the team were trying to do, it would be very hard to get funding in Tanzania. We didn't see any funding opportunities available for us in the scale that we were looking for. So I think in the ecosystem in Tanzania, at least at that time, 4 years ago, there was a lot of funding for what I consider to be SMEs, so small businesses, a ticket from $2,000 to $5,000. You would have, very rarely, we have competitions that will give up to $10,000, but we were looking for way more than that. And we knew that this is not something that we can get here in Tanzania. So our very first funding as a donation, and this was just a donation, a company liked our initiative, what we were trying to do, and they decided to give us their annual donation, and it was $10,000. So after that, we're looking for above $100,000. And we focused on Europe, on the startup ecosystem in Europe, to get that financing, and it's where we secured our first pre-seed funding that was a little over 300 million Tanzanian shillings, and we got that from female investors in Europe, in Switzerland and in Germany. So so far that is our sort of funding journey. We have a milestone as a startup to reach at least 10,000 users, and then we're going to go for a much, much bigger ticket, maybe 10 times what we raised before. So Mobile Afya is a USSD application, and USSD is a very old communication protocol. In essence, it's the same technology that we're using for M-Pesa or Tigo Pesa or any M-Wallet service, where you dial a short code, you receive a menu, and then you go ahead either to transact or to receive further information on text messages. So Mobile Afya works in that same way. We have a short code from TCRA. Our short code is *147*47, and the user dials a short code. Then they get a menu that has text, that has topics that they can learn about or information that they can receive. And they select the topic and they receive that information as text messages. It's from 4 messages to 6 messages per topic. And we cover a range of health-related topics from non-communicable diseases such as diabetes, heart conditions and diseases, cancer, and more, to neglected tropical diseases such as trachoma, river worms, and more, to also communicable diseases such as COVID19, coronavirus. We have information from what is the disease, to symptoms, to cure that is not available, but also to preventive measures, how to wear a mask, how to properly wear a mask, how to take preventive measures, and so forth. But also we have first aid. It's one of our most requested topic, where we are providing skills and tools for people to be able to give assistance in any health emergency. So for example, when there's a fire accident and someone is burnt, what to do as a first aid while you're taking them to the nearest health center, or when someone has drowned or someone is bleeding, what are the steps to take so that you can either save their lives or help them so that the problem does not grow or does not increase due to the condition. And we also have sexual and reproductive health. So we have an offline menstrual calendar for women. Now any woman who's using Mobile Afya can know about their next period, the next period date. They can learn about their menstrual cycle, but also they can receive information on their predicted dates or their fertility window, so when they're ovulating and when they can possibly get pregnant. But also we are covering a range of topics in adolescent health, focusing on young people and teenagers to give them the basic understanding about the changes in their bodies, but also information on STDs and their sexuality. And the last thing, we have nutrition education. And here we talk about, different types of foods, their roles, and balanced diets, and everything about nutrition. Also to emphasize on a healthy lifestyle when it comes to food intake. And for medical topics, those are the topics, but also we have gender violence. We've just added that as an educational content. So in a nutshell, that's how it works. Up to now, we have close to 2,000 users on Mobile Afya, and our goal in the next 3 months is to reach 10,000 users. Mobile Afya is an offline application. The protocol is accessible offline, and we're targeting people from low income to middle income in small towns and rural areas. We're targeting this group because we believe these are the people who need this service the most. These are the people who have narrowed channels of information. Also, these are people who live in areas where healthcare facilities are already a problem. So they don't have, especially in rural areas, many healthcare facilities. So for them to have information on preventive measures, but also health-related information is more, it's needed more than someone in urban areas because they have more channels of information. Nevertheless, Mobile Afya is also accessible for people in urban areas, but our target and our focus is for people in small towns, rural areas, and also marginalized groups. So we already work with organizations that deal with people living with disabilities. For example, in Moshi, we're working with Songambele that works with people living with spinal cord injuries, people who are disabled, cannot walk, cannot move. How do these people get health information? And these are people who have very special and very, I would say, extensive health issues and health problems, because also there is very limited understanding in our societies about people with disabilities. But also these are people who normally face abuse. For example, for women living with disabilities, they face a lot of, we've seen a lot of cases of rape, We've seen a lot of cases of abuse, just physical abuse, and so forth. So it's very important to us to also work with marginalized groups, not only people living with disabilities, but also people living with chronic diseases. For example, people living with HIV, because they are, they need the information, especially when it comes to nutrition or to diseases. They're more prone to getting some diseases or health conditions because of their immunity, especially for people who are not yet on a medication. So we're targeting also these groups, and we also have a special feature for HIV and AIDS that gives extensive information on HIV and AIDS. So yeah, this is all about the people we're targeting. There is no USSD initiative in the health sector that we are aware of that is done by a private company or that is done independently. There are a few initiatives by the government through Ministry of Health that have specific topics that I think it's tuberculosis and HIV, only information on tuberculosis and HIV. But when we went to acquire our code from TCRA, they told us that we were the first company to come and acquire a code for medical services. Normally it's for commercial services, for betting services, or for sports, or for these other kind of services. So, to my knowledge, I don't know any, but I know a lot of other initiatives that use offline technology through push SMS. For example, Wazazi Nipendeni, that offers maternal health content for pregnant women. I know that there was one of UN agencies that also had a push SMS initiative and service, but I don't know of any other USSD, existing USSD application that provide basic health information. So at the moment, we haven't had the need to differentiate ourselves, but we're also capitalizing on being the first in the market and really working hard to reach the target groups and grow our user base, as we're still the only player in the space in what we're doing, but we know that there will be more coming, and we'll have to up our game a little bit. But right now, there's none that I know of. I don't have any regrets. I believe that, especially in leadership and in innovation, you learn as you go. So everything, you're doing things that are new, you're doing things for the first time. It's not that you have knowledge. I don't have prior knowledge of running health tech startup. And so everything that I do is the knowledge that I've acquired from reading or learning, but practically I'm doing for the first time. So I am bound to make mistakes. And I don't consider them as a bad thing. I consider them as part of, the learning journey. The best way to learn is, through doing things and making mistakes. But the smart way to learn is to make sure that you learn fast from your mistakes and you don't repeat them. So I don't necessarily have a regret, but something I would do differently is in the very beginning, I was very focused on the local market. I think I wasted a lot of time seeking validation in this ecosystem, participating in competitions that I knew that just would not give us what we needed. And later I realized that does not work, and changed a way that I was engaging, especially with the tech ecosystem and innovation ecosystem here. But I wished I knew from very early on, and I would have the focus that I had later, I would have had that even earlier. It would be partnerships with players in the ecosystem. And by players, I mean telecommunication companies, because Mobile Afya works with mobile network operators. So we work with Tigo, with Airtel, with Vodacom. And it's my hope, it's still my hope that these companies will provide more room to work with innovators and with startups in terms of partnering with them and implementing these projects together. For us, for example, a revenue sharing model will work very well with MNOs, where we charge a subscription fee of 3,000 shillings. Majority of that, of that money goes to MNOs to cover SMS and session costs. So it would make a lot of sense if we could have a revenue sharing model, for example, with these MNOs, where they take a certain percentage of the subscription fee. We keep a certain percentage for marketing and for operations, and we don't have to pay them as service providers, which is what is happening now. So I think that could enhance very well. And using their network to reach more people, because they are in more places than we are. So I think partnerships, but not only with telecom companies, but also with global development agencies, with other companies. We also provide services for employers, for their employees to be subscribed to Mobile Afya and stuff. And I think winning or getting those partnerships would enhance our services and operations by far. I would say that has been securing or getting our first 1,000 users. When we hit that mark of 1,000 people using our service, that was really a big achievement. It validated a lot of the work that we did prior to that. The 4 years of the work, when we hit that milestone, that was a big achievement. But also, there are lots of small victories that led to a big achievement. And I think those are even worth to be celebrated more than the big thing that is like sort of an after effect. And I would say the team, the people that we work with, the medical team, the medical students, majority of our team members are on a voluntary basis, so they're volunteers, we don't pay them, but we have a very committed team who are also very passionate in educating communities when it comes to health-related topics. So the team, our co-founder, Dr. Hilda Ruth, who basically holds 50% of the base of the work that we do, and also our investors and people who have given us resources, enough resources for us to work. So all those are achievements or victories that led to this big after effects achievement of reaching 1,000 users. And now, hopefully, with many other small victories, we will reach 10,000 users. In a way, because when COVID-19 broke, unfortunately, I just traveled, had a business trip to go and meet one of our founding partners in Germany, and I arrived there a few days after Germany, and later, after a few days, the whole of Europe went on lockdown. So I ended up being stuck in Germany for 3 months, unable to travel, unable to come back home, unable to full-time work. And that was the same time that we had launched the pilot. So it was quite stressful, and it's slowed us down in a way. But also in Tanzania, I think in April, March towards April, we also put several measures in place. So our office had to close for a while and people work from home, and majority of our activities were on the ground. So going to people, to local communities, door by door, subscribing people, when we couldn't do that because of the pandemic. For a while, we couldn't do that. So that slowed us down a little bit. But also we were working to get approval from Ministry of Health because all the content that is disseminated to public needs to be approved, needs to be reviewed and approved by Ministry of Health. So at that time we had submitted our content for approval, and COVID-19 happened. So the whole focus of the ministry and everything was on COVID-19. And that slowed our approval for several months, and hence slowed down our work for also several months. So in that way, it did affect us, and it was quite a challenging time. I am very optimistic, extremely optimistic. And I see Mobile Afya as the leading provider of health information in Africa. So I see us working in different countries, in different languages. In 3 to 5 years, I see us in 10 languages in Africa, working in different markets with partnerships. I see us having more than 5 million users. I see us growing our technology from just USSD to smart apps as well, and to web applications as well. I see us growing our team. I see more diversity, but also I see us shaping the narrative or transforming the narrative of innovation in the health space. My advice to our authorities and our regulators is that they need to be more open-minded. They need to go at the same speed that the world and also the ecosystem is going. Because what I have noticed is that there is a lagging when it comes to government authorities or authorities. They're not on the same space yet as we are. They don't consider, or maybe they consider, but they don't take tangible actions towards openness to innovation. They also do not have a room yet to include innovations and innovators and young people in their activities. And I think if that would have been the case, getting the local support directly from the minister, maybe even working with them directly, could have given very different results. So I think, more can be done. More can be done in terms of, being more engaging, and also not only engaging by, inviting them to a meeting here and there, but by having tangible actions towards including innovation in government authorities or in the conduct of our ministries and other authorities. Something else is, I would say, bureaucracy. But this could also be just because we are new as young people. We hope things to work in certain ways. We hope things to be efficient and fast and effective. And when you interact with many authorities, I would say, except TCRA. I think TCRA was very different. It was very effective. It was very straightforward. We knew beforehand what is needed. All the requirements were on their websites, what is needed, the fees that you have to pay, where you have to pay. So the process was very smooth with TCRA because the information was provided beforehand. But I wouldn't say that to other authorities and regulators, and especially our government authorities. So I think, more can be done in that aspect, that also to cut some bureaucratic processes. I think I was very glad when the president, our sixth president, addressed this and said, in many of our ministries and in our government agencies, we don't want to make decisions. You sit with something, you receive a request or a proposal, a plan for work, or a memorandum of understanding, and you will sit with it for 3 months, for 5 months, and it might be circulating from this department to the other, and you're wasting time. And for example, for a startup, you have a certain amount of money and a certain run time. So you have investment, for example, for a year, to pay people for a year, to work for a year, to give certain results or milestones or deliverables for that year. But you find that in the year, you have 6 months of bureaucratic processes that you're burning money and you're burning resources, but you're not getting results. And that is really difficult to explain to investors in the business aspect. So I think our authorities and the government can do better on that aspect. I would like to thank Media Convergency for this opportunity, but for this initiative, even more importantly. I think it's very important to share stories, but also transform the narrative when it comes to the innovation and tech space in Tanzania, to allow entrepreneurs and to allow innovators to tell their own stories, to also highlight their work. I think this is something that was missing in our ecosystem. And there's been a tendency of having only certain either businesses or companies that are already established have the spotlight. But I think the work that you're doing really covers, and you really try to cover all the players that are in the ecosystem. So I think this is really great. It's important, it's needed, it's really essential also for the growth of the tech ecosystem and impact that the tech ecosystem has in the country. And I mean, good work. Please keep it up. And I am very glad that you had me here today. Thank you.